Celeste and I are going to demonstrate the clock drawing test. The population this would be useful for would be stroke, post-surgical, for my assignment purposes, Alzheimer's disease, or anybody with dementia. The context where the test could be used in would be the patient's hospital room or in their own home, or whenever you're doing the patient evaluation or even the interview process. The test and retest reliability is really high, and the reliability. And then validity, the statistics were not applicable, or they just hadn't been assessed yet. My rationale for the selection is it's a good screening tool for dementia and other cognitive impairments. It might indicate spatial dysfunction and neglect. The test requires verbal understanding, special coded knowledge, and constructive skills. So basically what I'm going to do is draw a face of a clock on a white piece of paper. It should be fairly large for the patient, and then I'll have her denote a specific time on the clock face. And what I'm looking for is that she numbers the clock correctly, that the numbers are spaced out correctly, that the hands of the clock are differentiated in size, and that she gets the time correct. So, alright, Celeste, so what I want you to do is number the clock, and I want you to denote the time 10 past 11. Good job. So, okay, did you? So, good job. So, as we know, like if someone drew the clock correctly, the small hand would be right here on the hand, on the 10, and the big hand for minutes would be right here on the 2. Another variation you might see if they drew it incorrectly would just be spatial issues with the numbers, or not getting the time correct at all. There may be no differentiation between the hands, so those are just some things you could look for.